Hand washing before and after patient care is essential in the prevention of the transmission of microorganisms between clients and hospital staff. Rinse, then lather thoroughly between the fingers, wrists and forearms, around the nails for at least 15 seconds. When rinsing, allow water to run from the least contaminated areas, such as the fingers, to the most contaminated areas, such as the elbows. Antiseptic alcohol solutions such as Avogard can also be used to sterilize hands between patients. We are using a tympanic membrane sensor to confirm the client's temperature, as it is quick, the ear is easily accessible, and the temperature is unaffected by oral intake of foods, fluids, or smoking prior to testing. The thermometer also provides a core body temperature reading, which is more accurate than a surface temperature reading. The temperature should be in the normal range of 36 to 38 degrees Celsius. Anything above 38 degrees Celsius is considered hyperthermic. A temperature below 36 degrees Celsius is considered hypothermic.
The most common place to take the pulse is the radial. This is located laterally on the wrist. Use your middle and pointer finger. Count beats for 30 seconds and times the result by 2. If the pulse is dysrhythmic, count for full 60 seconds. A low pulse rate is bradycardic and a high pulse rate is tachycardic. You should take a client's respiration whilst taking their pulse because it gives a more accurate reading because the client is not concentrating on their breathing. Count for 30 seconds and times the result by 2. If irregular, count for full 60 seconds. A high rate of respiration is hyperventilation, a low rate is hypoventilation.
Before taking a blood pressure reading, check that the cuff size is appropriate. Approximately 80% of the cuff bladder should cover the arm circumference. Fit the cuff at the cubital fossa so that it's snug. A loose cuff could result in a high reading. Place the diaphragm side of the stethoscope over the brachial artery, tighten the pump valve, inflate the cuff 20 to 30 mm of mercury over the palpated systolic pressure. Undo the valve so the pressure falls at approximately 2 to 3 mm of mercury per second. The moment you hear the pulse, that is the first reading, which is the systolic pressure. When the pulse drops from hearing, that is the second reading, which is the diastolic pressure. Record the pressure as a fraction such as 120 over 80. The 5 sounds heard from systolic to diastolic pressures are known as the Korotkov sounds. First is a sharp tapping, second is a soft swishing, third is a crisp, sharp tapping, fourth is a muffled tapping, and last is the sound of silence.
Within the sound of silence, in restless dreams I walked alone, narrow streets of cobblestone.